What foods could help you against erectile dysfunction? Hello friends, I'm Dr. Borja Bandera. Welcome to the new video. Erectile dysfunction is a health problem, more common than we think. When we talk about erectile dysfunction, we're talking about the inability to achieve an erection or maintain it for a sufficient amount of time to enjoy a close relationship. Yet because of stigma, taboo, or simply out of embarrassment, many men have this problem and do not seek help. They don't consult a doctor, and often they don't even tell anyone, not even friends. They keep it to themselves. We will now examine the primary causes of erectile dysfunction. But the question I ask you is, do you think it's related to lifestyle, to what we eat, to what we do? Clearly the answer is yes. There are many factors in your lifestyle that can worsen or even precipitate erectile dysfunction. To give you an idea of the magnitude of the problem, in males under 40 years old, up to 2 to 3% of those males may have erectile dysfunction. But when we look at series of males over 40 years old, up to 50% can have some degree of erectile dysfunction. So it's a problem, as you can see, quite frequent. Treatment. What can medicine offer me to combat or improve this problem? Well, luckily there are treatments. There are oral treatments, pills, there are less pleasant treatments, or those that are intraurethral or even intracavernous. That is, there are pharmacological tools that are going to help us. But on this channel, we talk about lifestyle. Today I'm going to explain, I think they have come out, 8 foods that can help you to improve or even prevent erectile dysfunction. But first, of course, you have to understand what the causes are of erectile dysfunction, hence my standing here. One of the most common causes is a reduced blood supply to the organ. Less vascular flow. What's happening? Well, when the cardiovascular system, the arteries are compromised, they are less healthy, they have disease. This usually happens in metabolic disease like diabetes or type 2 or in cardiovascular disease. And here we have to make an appeal, a wake-up call, because erectile dysfunction is usually a marker of endothelial damage. What does this mean? The endothelium is the inner lining of the vessels. If you imagine a blood vessel like a pipe, well, that pipe will have an external coating, but it will also have an internal inner coating. That inner lining is the endothelium, which is an organ in itself that produces substances, contracts, dilates. Well, that endothelium is damaged and has less capacity to dilate, to vasodilate in erectile dysfunction. Think about when erectile dysfunction appears, there is probably some degree of endothelial dysfunction. And we can't let this go because it could be one of the earliest indicators of cardiovascular disease. Second cause, alterations. Hormonal. As could not be otherwise, there are many hormonal disorders and problems that can condition erectile dysfunction. Hence, endocrinologists also treat erectile dysfunction patients. A testosterone synthesis production lower than necessary is one of the causes. Hypogonadism or very high prolactin can also generate hypogonadism and produce this problem of erectile dysfunction and low libido. Uncontrolled or poorly controlled high blood pressure is also a cause of erectile dysfunction. Dyslipidemia contributes to that cardiovascular disease and contributes to that endothelial damage, that is having an alteration, an excess of lipids, of fats in the blood. Aging is a physiological cause of erectile dysfunction, it's obvious. That's why as the decades go by, there is more prevalence of erectile dysfunction and so many other things. Unfortunately, we get old, we age. Sixth point, medication. There is a lot of medication, many drugs that are prescribed and that facilitate a lower libido and erectile dysfunction as well. Antihypertensives, blood pressure medication, diuretics, and often antidepressants. Prescribed drugs for mood disorders. Of mood? The seventh point, the seventh cause is tobacco. It's a social scourge that generates a lot of helplessness among health professionals because we really run out of tools to make people not smoke. And people keep smoking and keep producing, self-producing these kinds of problems. Tobacco is probably the most of it. Harmful to the blood vessels, not to mention the most harmful thing we have among what we do in our lifestyle. The eighth point is alcohol. High alcohol consumption is also a frequent cause of erectile dysfunction. Don't drink alcohol or drink little alcohol. Ninth point, overweight and obesity, which is probably one of the first causes today of erectile dysfunction because it is related to diabetes, cardiovascular disease, hormonal alterations, hypertension, practically with everything we are discussing in the causes section. And finally, something that worsens everything: psychological causes, stress, anxiety, depression, family problems, work problems, relationship problems, all that enhances the physiological causes of erectile dysfunction. And there is always a certain psychological component that sometimes is prior to the problem or sometimes is secondary. To the problem, we move to section number 3 that I have to avoid very quickly, perhaps, before considering introducing new elements, which is the next section. We will have to consider that we avoid in our lifestyle. Well, avoid simple sugars and refined carbohydrates because they are related to many of the things we have seen in the causes. Cardiovascular disease, type 2 diabetes, obesity above all. Avoid ultra-processed foods for the same reason. Avoid alcohol because we've already mentioned it here, and avoid tobacco because we've already mentioned it in the causes as well. And now we move on to the most interesting section, and since we've done this background of causes and of where the problem might be, the first element or food is extra virgin olive oil, which you already know is very healthy for many other reasons. But here it's content in MUFAs, which are MUFAs Borja. MUFAs are monounsaturated fatty acids, which are especially interesting for hormone synthesis. Therefore, the role of olive oil in hormone synthesis that will improve that erectile dysfunction. Second point, blue fish. Why? How does blue fish relate to this? Well, the role of blue fish is conditioned by its high omega-3 content and the improvement in cardiovascular health and the endothelial improvement that these omega-3 fatty acids generate. The third food is not really a food as such. It is a phytonutrient that is in many foods. They are flavonoids. As I say, flavonoids are phytonutrients, nutrients, bioactive compounds present in plants that are in different foods and that improve the health of the endothelium. The endothelium is the key organ here in erectile dysfunction, enhancing endothelium health. We are going to improve the problem. Strawberries are rich in phytonutrients and flavonoids, blueberries, citrus, apples, or pears. Many fruits are very rich in flavonoids. That's why I have already mentioned in other videos that fruits are highly recommended. The fourth point, the fourth food, cocoa. Cocoa, present for example in dark chocolate, is a great vasodilator food. It has different substances that produce vasodilation. That is, they cause the blood vessels to open and pass. It circulates blood via blood vessels and contains many flavonoids as mentioned before. Therefore, dark chocolate, at least 85% from there on, included in your diet if you have any problem of this kind. Fifth food, again a fruit that I have talked little about on the channel, but that is really good and that has many benefits. It's the pomegranate. Pomegranate has even been shown in some studies to increase testosterone levels. It has been shown to increase libido in both men and women and in studies. Preclinical studies have even shown some antineoplastic activity in prostate cancer and other urological problems in men. So pomegranate, superb food. Sixth point, also another fruit. You'll be surprised because there are so many fruits on this list, I don't know. Could it be that fruits have very interesting bioactive compounds for erectile dysfunction? Well, it could be. The sixth one is watermelon. Now that we are in the hot season, watermelon, some authors have even started to call watermelon a natural Viagra. I stay quite far from giving it that qualifier, but it is true that it contains two elements that are especially interesting in erectile dysfunction, and those are L-arginine and the citrulline. You may wonder, what's the relevance of arginine? With citrulline, these amino acids in erectile dysfunction, arginine is important as it is a precursor of nitric oxide. Citrulline also increases the synthesis of nitric oxide. What is nitric oxide? Well, we could say that nitric oxide is the molecule with the greatest vasodilator potential in the body. Increased nitric oxide production has been associated with reduced tensions, as the pipes aren't as tight. They've become relaxed instead of contracted and rigid. The pipes are the cardiovascular tree, you have understood me, and therefore everything that contributes to the synthesis of nitric oxide is going to help improve the problem, therefore watermelon. In the same line, in the same thread, in the seventh point are the inorganic nitrates, which are again compounds that facilitate the production of nitric oxide in our cells. Where can you find inorganic nitrates? They are abundant in beetroot. Hence, many athletes, particularly endurance ones, consume a lot of beetroot juice before a competition. Why? To boost inorganic nitrates. Why? To boost nitric oxide levels. Why? To dilate the vessels and get more blood to the rest, to the muscle tissue. Why? Well, to carry more oxygen, more hemoglobin and oxygen to the muscle cell, to the muscle fiber, so that it contracts more efficiently. Hence, beetroot, cabbage, spinach, lettuce are vegetables rich in inorganic nitrates. Regular incorporation of them will be beneficial. And finally, the eighth food, which is not a food, it's a supplement, is ginseng. A supplement that is usually taken to have more energy, more vigor during exam periods. It can be included in multivitamin supplements. It is used in this line, but it has also been shown to improve libido in both women and men. Therefore, it can also help. That's it for today's video, where we discussed what erectile dysfunction is. We've noticed this issue occurs very frequently, that we usually keep it to ourselves and don't say anything. Mistake, because it conditions a lower quality of life, and there is no need nowadays to keep things to oneself. Second, we have seen the causes of erectile dysfunction, which are usually linked to a poor lifestyle. A lifestyle involving tobacco, alcohol, stress, and poor sleep. I didn't state it, but obesity, hypertension, dyslipidemia, cardiovascular disease, all these preventable factors are involved. Only one can't be improved, others can. To this day is aging third point. We have given some guidelines for you to eliminate things from your diet. And fourth point, we have given a list of up to 8 foods and supplements or bioactive compounds that can really help you, in the improvement of direct dysfunction. If you like this video, share it. See you next time. A big hug and keep empowering.